in a case in which LDN is taken to improve thyroid function rather than have any analgesic effect, increasing LDN dose to 3 milligrams produced a slightly dysrhythmic feeling, which I assume is an aspect of increased endorphin activity. What might be done regarding those? So, dysthymic feeling. So, when you take naltrexone, it does block opiate receptors in your brain. And those opiate receptors are part of your body's natural reward system. So in some people we do find it in Hashimoto's patients quite often, they are very sensitive to that. So if you take out too much LDN at once, you can get a feeling of being very flat or being almost like out of your body experience, which happens to very, very few people, but it can just be an effect of the naltrexone. So if someone is getting that effect or they're feeling that they're sort of very flat or they're not being able to experience emotions correctly or respond to things properly, they're probably on too much LDN, and you want to drop right back to 1 milligram and only increase at 0.5 milligrams on a week or every week or 2 weeks until you get a dose that's working for your, in this case, thyroid control, but isn't giving you that particular feeling. So I would say that you're probably on too much LDN, drop it back and take it more slowly and getting up to the dose and making sure that you're absolutely having regular thyroid tests every 2 to 3 months to make sure that we haven't reversed the autoimmunity of Hashimoto's disease very quickly and that you're getting this rush of far too much thyroxine or far too much T3, T4 in your body, which could also be causing that effect. So with Hashimoto's, it's quite important to make sure that you go low and slow and have regular thyroid tests. If you switch from taking LDN from nighttime to the morning, can it interfere with the thyroid meds? And second, does it have to be taken at the same time every day? I've been on LDN since 2011. Well, there we are. There's someone who's been on it for a very long time, but with MS and Hashimoto's. So absolutely, the answer to your question is it doesn't interfere with the thyroid medication in any major way. It should make no difference to how well that's absorbed or either of those things are absorbed. And yes, you do have to take it at the same time every day. And if you're swapping from nighttime dosing to morning dosing, skip a day and take it in the morning thereafter. So with Hashimoto's and has their thyroid, but have been on thyroid meds for 10 years, can LDN still bring back some normal thyroid function? And the answer is yes. Even with people who have long-term Hashimoto's, we have had cases where taking LDN has brought back some thyroid function. So again, the same advice as earlier on, do not go up too quickly and monitor your thyroid and your thyroxine doses while you are titrating up. Can LDN restore thyroid function? So this is a bit of a complicated question, but we have covered it in the previous questions in Hashimoto's disease. So where you still have intact thyroid and your thyroid is being attacked by your body in an autoimmune way in a disease like Hashimoto's disease, then yes, absolutely, taking LDN can dampen down that autoimmunity and can also help restore thyroid function. And sometimes that works incredibly dramatically and very quickly, and it is problematic. So you do have to make sure that you modify your doses of externally taken oral supplementation with thyroid medication in line with your blood test results if you have an autoimmune thyroid condition. If you've had your thyroid removed, then no, it's not going to do anything for your thyroid. So we do have patients ask that quite frequently. They had thyroid cancer and they've had their thyroid taken out. Could LDN help them get some thyroid function back? And most people, the answer is no.